As of right now, Colorado health officials have reported 24 deaths from COVID-19 in our state. But Kevin Vaughn from our 9 Wants to Know team found that, like infections, the number of people who have died from the disease is almost certainly higher.
Gunnison County's first COVID-19 death reported a week and a half later. Boulder County's delayed 3 days.
There will always be some lag time in reporting.
That's the reality for Scott Bookman, the state's COVID-19 incident manager.
In some cases, there will be investigations to really determine what the cause of death was that could result in a slight delay in the reporting of that information.
Dan Vigil died Sunday.
In order for us to be able to report a death as caused by COVID-19, we need to have a positive test result.
Chana Gausetis of Boulder County Health said confirmation came 3 days later. Those delays and other realities lead to this question. Is there reason to wonder if there are more deaths than have been reported?
Absolutely. If somebody dies from respiratory symptoms or something caused by underlying health conditions and they had respiratory symptoms, it may very well have been COVID-19, but we don't know because they weren't tested.
Kevin Vaughn, 9 News.
And even though authorities acknowledge a lag time between the actual deaths and when they're reported, there's no way to know what the average delay is. That's because in all but a couple of cases, authorities reporting a COVID-19 death did not provide the date the person died.